Welcome to CareLink SF. CareLink SF is the electronic medical health record used at the San Francisco Department of Public Health community and hospital-based clinics. eClinicalWorks is the program CareLink SF uses. This module will orient you to some of the most basic features of the program, as well as the very specific workflow for students. The workflows were developed to reflect clinic practices and maximize the advantage of CareLink SF. You are strongly encouraged to frequently reference these workflows, which can be found in binders located throughout the clinic. Workflows assure smooth communication between staff during patient visits. They also provide you with some practical how-to within CareLink SF. Begin by clicking on the eClinicalWorks icon. Then log in using your CHN login. A password will be assigned to you. Once logged in, you will be brought by default to the office visit screen. Your name will appear in the uppermost gray band. It's a good idea to get in the habit of checking that your name is the one that is actually there. In the darker blue band next to the ECW logo is an icon of a man with a magnifying glass. Click on the icon to access patient lookup. We'll be going into detail as to how to use patient lookup in just a few minutes. To the right of Sherlock are jelly beans and their associated links. Jelly beans are another way to navigate throughout CareLink SF. They also act as task inboxes for regular clinic staff. For example, lab results will show up in the Ordering Providers L jelly bean. From here they can be reviewed and addressed. As students, you'll have very little to do with jelly beans, but it's helpful to know that if you click on the S jelly bean, it will always return you back to the office visit screen. The office visit screen displays those patients who have already checked into the LCR. At this time, it's not possible to create new appointments or view future appointments in CareLink SF, though this should be changing in the near future. In ECW, appointments may be made with providers or with resources. Providers are licensed physicians, and resources may also be licensed physicians, or they may be a kind of clinic. For example, PEDSHOT would be an example of a clinic that was not a provider and solely a resource. To view the patients that have arrived for a particular clinic, click the ellipsis next to the search box here. Then you can choose all providers, all resources, or all providers and resources. Scroll down the list. Click the box next to the provider or clinic that you want to choose. Click OK. You'll be able to see your patients. It is possible to view more than one clinic at one time. Taking you column by column on the office visit screen. This first column will display the lock icon. If a note has been locked or signed, it will show that it has been locked. This is the visit type. The appointment time is the time that the patient actually was supposed to be in the clinic. Their name, the clinic that they're scheduled in. So in this case, they are only scheduled in one clinic, Sam Willis's clinic, so just Sam Willis's name is there, but if it was more than one, you would see initials of the clinics. If a reason was put into the LCR why they're being seen, that would show up under reason. Their sex, their age, the visit status is once they arrive and are checked into the LCR, this will turn green with an ARR. When they check out, it changes to yellow and a CHK. Once they have arrived, it initiates the cycle time for the duration of the entire visit. So this is the actual time that they arrive, and this is the actual length of time they've been here since they've arrived. There are two check-ins that are done in CareLink SF. The first one is done in the LCR by the front desk. The second check-in is called the clinical check-in, and the next few columns will reflect information generated by that. The clinical check-in is usually initiated by the MEA or RN. They'll highlight the patient, click check-in or out, click check-in, which automatically puts the time. They'll enter the room number, and then they'll put a status. In this case, it's intake. Now you can see these columns populated by that information. Any of that information can be edited or changed by clicking on the box. The cycle time next to status will reflect how long a person has been in that status. The status reflects where a patient is in the visit. To change a status, click in the column next to the patient's name. Typically, after the clinic staff finishes their patient intake, they will change the status to ready, which means the patient is ready for the provider. When the provider goes in the room, they will change the status to provider, which means that the provider is in the room with the patient. When finished with the patient, they can then change the status to either order DC, which means complete orders and then discharge, or orders RP, complete orders and return. Other possible status codes are ADM, meaning awaiting for admission to the hospital, eligibility, patient is in eligibility processing, and status 1, 2, 3, and 4, which will vary depending on clinic. Just as there are two check-ins, there are two checkouts. The clinical checkout is done from the same screen as the clinical check-in. Check in and out, and then it can be seen over here. The second checkout is done by the front desk from the resource schedule screen. To look up a patient not yet checked in, go to Sherlock, click on the icon, then search using the qualifiers here. Be sure your search term matches the qualifier. When RTS is checked, the system will populate possible results as I type. If I need to further narrow my search, I can use the qualifier to the far right and add, for an example, a patient's date of birth to narrow my results. Once I find my patient, I'll highlight them and then click on patient info if I want to go to their demographics. Or double click on the name to go to the patient's hub. I can also get to the patient's hub by clicking OK. Patient Hub provides quick single-point access to all information related to a patient. The toolbar provides access to the patient's past and present test results, immunizations, referrals, allergies, and, in certain clinic workflows, notes. Patient demographics populates the next portion of the patient's hub. Remember that we are not doing billing in CareLink SF, nor will you be able to view the next appointment. The right chart panel displays a quick reference of the patient's progress notes window, giving the provider easy access to the patient's history and other information such as medications, allergy, alerts, and immunization. The right chart panel is available on all patient-related screens. Finally, the Hub buttons provide quick access to the medical records of a patient and also to frequent tasks that are used by all clinic staff. From here, you'll be able to create a new telephone encounter, which is a central part of the student workflow. The first step in a student's workflow is to create a telephone encounter. An encounter in CareLink SF can be an in-person visit with a patient documented on a progress note, or an interaction occurring other than face-to-face, for example, a telephone call, and documented on a telephone encounter. Telephone encounters are also used for interventions on behalf of the patient, for example, ordering a prescription refill. All documented encounters, both in-person and virtual, become part of the patient's permanent record. The most efficient way to create a new telephone encounter is from the Patient Hub. That's because when doing it from the Patient Hub, certain fields are already populated with patient information, for example, their demographics or their pharmacy. The Patient Hub can be accessed using Patient Lookup, and you've already seen how that's done. The Patient Hub can also be accessed from the patient dashboard, which is located on any patient documentation. If the patient is already in clinic, double-click on their name, and a progress note opens up. This area here is known as the patient dashboard. The patient dashboard contains brief patient demographic information. If a clinic is taking pictures, their pictures will appear here. If there are allergies, an allergy alert will appear here. These yellow squares here are known as sticky notes and also contain brief patient information. The yellow sticky note is used to communicate to staff members in some clinic workflows. Underneath this are links to different parts of the patient's medical record. Over here in this pull down, if there are other family members that are seen in clinic, they'll be listed here. And a list of the patient's encounters, in-person visits, and telephone encounters are listed here. Next to the patient demographics in the left corner are 3 links. Select takes you to patient lookup. Info takes you to patient demographics. And then Hub will take you to the Patient Hub. Once in the telephone encounter, change the time to a few minutes before the appointment time. So if the appointment time was for 10, I'm changing it to 9:55. Where it says reason, type in student note. Select virtual visit from the tabs in the middle of the screen, and on the bottom of the screen click on Progress Notes. You're now in a telephone encounter progress note, which looks very similar to the in-person encounter progress note. 2 ways that we know it's a telephone encounter, though, is one, it says telephone encounter in blue in the upper right-hand corner, and the other way is that all the encounters over here are listed, and there's a red T, and that means telephone encounter. If you use the pull-down menu, you can see a list of all the encounters, both telephone and in-person. The next step in the student workflow is to chart. Begin by clicking on the heading in the progress note. A screen for charting opens up. Clicking on the headings in the progress note is one way to navigate through a progress note. Another way is to use the icons on top. Hover with your cursor in order to identify what part of the screen the icon is linked to. A third way to navigate through the progress note is to use the buttons in the lower right corner. They can go forward, or you can return to where you were before. And finally, a last way to navigate through the progress note is to use the menu bar here and click on Encounter or Physical. Begin with Chief Complaint. If entered, a patient's chief complaint will be brought over from the LCR. To add a chief complaint, click Browse and either search for a chief complaint using the Find dialog box here, browsing through the list, or creating a new chief complaint. You can also add a chief complaint by clicking Add and free texting in the box. To remove a chief complaint, highlight and click Remove. Current medications are where medications that the patient has taken are listed. It's for information only, as ordering and refill would be done in the treatment portion of the progress note. Once medications are verified, check the Medication Verified box. If a patient says they're taking a drug but doesn't know the dosage or frequency, be sure Prescription Name Only is checked. To add a medicine, click Add. Type in the medicine you're looking for. If Prescription Name Only is checked, it doesn't really matter which one you choose, because when you click OK, just the name will appear. To be more specific, unclick Prescription Name Only, click Add, type in the medicine you're looking for, choose it, and if you need to edit it, click on the little pencil over here and enter any additional information. Past medical history will populate the progress notes from visit to visit, both virtual and in person. Add or remove as you did for chief complaints. When finished, click History Verified. To review, verify, or add information under social history, hospitalizations, or surgical history, follow the same steps. Remember, even if nothing has changed, be sure to check the verified boxes. To chart on family history, click on the family member's status to indicate whether they're alive, deceased, unknown, or leave it blank if they don't exist. Record the date of birth, and the age will automatically populate. To add a diagnosis, click on the Notes section and either choose from the left-hand column or free text. If more than one family member has the same diagnosis, you can choose them and it will appear in their Notes section individually. Here you can indicate numbers of brothers, sisters, whether they're healthy, sons and daughters, and you can free text in the Notes section any additional information. I can access the HPI by either using the icons up here or using the pull-down menu under Encounter. To chart the history of present illness, I can choose a category from the left-hand side. Note that this category now appears in the tabs on top here. You can choose complains of or denies. Choose complains of, the HPI Notes opens up. Here you can free text any information and add any qualifiers using the pull-down menus. You can also free text under the Notes section here. You can chart denies all, or you can chart clear all. Another way to chart in the HPI is to click on Interim History in the left panel. Click on the ellipsis in the right window, and then free text what you want to write over here. Your examination is under the objective portion of the progress note. It's arranged like the HPI with categories on the left and observations under associated tabs on the right. The green arrows will populate observations with default assessments. Double-click under the observation in order to free text any additional information. When you're done with examination, you'll go to Assessments. In ECW, assessments are diagnoses. You're going to write your assessment and plan in the Notes section of the assessment screen. When you're done with that, you're done with the charting. X out. And you're going to click on the telephone encounter in the right-hand side. It brings you back to the original telephone encounter. And now you're going to merge in the note disclaimer. Select Action Taken. Select Browse. Select Student. And select OK. The very last step in your workflow is to assign this note to your attending. Over here you'll find a pull-down menu under Assign To, where you will look for and find your attending. Very important, in this box here is the status of the telephone encounter. Always leave it open. That will make it easy for the attending to find the telephone encounter. Click OK. Then you can return to the office visit screen by clicking the S jelly bean, or log out of ECW completely by clicking the X in the upper right hand corner. A few important things to remember. Make sure you're charting under your own login. Chart your note on a telephone encounter. Remember to check the verified boxes. Remember to merge in the student disclaimer, add action taken, browse, student, OK. Assign your note to your attending. Leave the telephone encounter status open. Check your workflow and ask for help. This concludes this video.